In the next set of videos, myself and Sophie are going to do exercises that are really focused for patients who are suffering from something like osteopenia or osteoporosis. So by way of background, in this video, I'm going to talk a little bit about what those conditions are. I'll then do another short video where I explain the best kinds of exercise to be doing if you have osteopenia or osteoporosis. And then I'll do another short video on the safety aspects, because I can understand that a lot of patients would feel a bit concerned or worried that actually doing these exercises would increase their risk of injury. So I'll go through that as well. So just by way of background, as we age, our bone breakdown begins to exceed our bone formation. And what can happen is you can develop what's called osteopenia, followed by osteoporosis. So we have a normal bone density level. Osteopenia would then be the first level below normal bone density, and osteoporosis would be a level below that again. So when it comes to your risk of developing something like osteopenia or osteoporosis, there are a number of factors that can contribute. Age, like I've already said, is one factor. In women, estrogen levels decrease around the time of peri-menopause and into menopause, and this has a huge impact upon bone formation. So that is probably the highest risk time for women. If you suffer from something like a chronic illness, like chronic diabetes or chronic heart disease, and you lead a less active lifestyle, so you're more sedentary, there can also be an increased risk of developing bone loss as you age. Being treated with long-term steroids is another well-recognized risk factor for developing osteoporosis or osteopenia. Now, the good news is that bone is dynamic and it can respond to impact and loads over time, and you never actually lose the ability to respond to exercise. It is greatest from a young age, and it does gradually decline as we age, but it never actually goes away. So that is a really good positive thing about exercise. So no matter what time you start it in life, you do stand to gain some benefits. When you go to your doctor or your healthcare professional to have an assessment for your bone health, there'll be a number of clinical factors that they will ascertain from your history. So your age, your background medical history, whether or not you have ongoing significant risk factors for osteoporosis, like being on treatment with long-term steroids, if you have early menopause or you are in menopause years. For men, if you have low testosterone levels, if you have a history of excess alcohol use or a smoking history, and if you have low vitamin D or calcium levels. And based on that, your healthcare professional can then help decide if you fall into a low risk or a medium risk or a high risk category when it comes to something like exercise. So low risk would apply really to people who don't really have any issues with their bone health. So this would be probably all women in a pre-menopause time, most men, and actually really applies to women in the perimenopause and the early postmenopause years if you have no ongoing risk factors for poor bone health. So here the exercise is really for prevention and to just have good bone health over time. And all exercise is safe. Then we have the medium risk category. Now this applies to people who may have had a diagnosis of osteopenia. So you might have gone to your doctor and they decided to do a bone scan based on risk factors you might have, or there might be a strong family history of osteoporosis. And it does show that your bone density falls into the range consistent with osteopenia. Now, in this case, you have not had any bone fractures. And again, exercise is very safe, and really you can exercise in the same way as the low risk people. And actually, I forgot to say, with the low risk people, you don't need a bone density scan to tell you that you're low risk. It is enough to have the clinical assessment with your doctor or your physiotherapist to say that your bone health is sufficient and you can go ahead with the exercise. Then we do have a higher risk category, and that would really apply to people who have an established diagnosis of osteoporosis. Even here, exercise is largely considered to be safe, but there does have to be an element of caution applied, and there are certain types of exercise you shouldn't do, which I'll explain in the safety video. The most important point really is whether or not you've had a fracture. So if you have osteoporosis or osteopenia and you've had a fracture, this does place you in a slightly higher risk category. It doesn't mean you can't exercise, it just means that you should probably have supervision when you exercise, maybe chat with a physiotherapist before you start an exercise program, it'll likely still be safe, and you will be advised to start in a very gradual sense. But you know, these videos are being brought online, so it's very hard to say at an individual level that it is safe for you to exercise. So an element of caution needs to be applied if you have had a fracture. Now, the last thing I'll say in this video is that the exercises that we are doing in these videos are in combination with the treatment from your doctor. So this isn't an either or situation. You should remain on whatever medication you've been advised to stay on, and you should also stay on supplements like vitamin D and calcium that have also been advised from your healthcare professional.